If you're like myself and you're interested in your own health, the health of your family, and the health of this nation, then you're going to love this episode where we dive deep into the MAHA movement and Robert F. Kennedy Jr. and knowing what he's up to. There are so many things that he's working on behind the scenes, and I've had the privy and the privilege of being able to spend some time with a lot of the people in the MAHA movement, whether it be Marty Makery, Mehmet Oz in the past, Robert F. Kennedy Jr., a lot of the other people who have been involved, like Vani Hari, I'm texting with and calling and talking to on a regular basis. And so what I'm going to share with you today is what I know Robert F. Kennedy Jr. is up to in leading the MAHA movement and the biggest initiatives and things he's trying to accomplish over the next 4 years. And again, this is important because it's going to impact your health and your future in a big way. Welcome to the Dr. Josh Ack Show. So here's what MAHA is. MAHA is a nonpartisan movement. Again, it's not political. Everyone is trying to make it political. It's not. It stands for Make America Healthy Again, and it's a grassroots movement advocating for health freedom, and it's been sloganized by Robert F. Kennedy Jr., who is now the United States Secretary of Health and Human Services. Some also say it could stand for Medical and Health Accountability. It calls for bold, sweeping changes to fix America's failing healthcare system and holding organizations and systems accountable like pharmaceutical companies, agricultural companies that are doing great harm to our nation and even the world. In February of this year, President Trump issued an executive order establishing the president's Make America Healthy Again Commission to improve the health of Americans, particularly children. Now, I've been very blessed to be invited to places like the White House and also be part of some of these commissions. I'm actually going to be going sometime here in the near future to Washington, D.C. to testify in front of Congress and others and talk about the problems with our healthcare system and some of my ideas to start to fix the problems. But overall, MAHA consists of many doctors, parents, and advocates who want to take back our health from corrupt institutions, clean up the food and drug system, and give people freedom to make informed choices. For instance, don't you want to be able to choose whether you vaccinate your kids or not? Shouldn't you have the freedom to drink raw milk if you want to? Right? Shouldn't we have these freedoms? Shouldn't you have the opportunity to have access to cutting-edge medical care like stem cells and peptides, many that are used in other countries, but are still illegal in the United States? And one of the things RFK Jr. is doing, and I've been able to have conversations with his staff and team and find out what is he doing behind the scenes to start to fix all of these problems. I also want to say there are so many amazing people that are part of this movement. You know, I've been, been able to be really blessed to be connected to Vani Hari. She goes by the Food Babe. But Vani is an amazing mom. She's an amazing activist, an amazing leader who's been leading the charge regularly. And so she is a big person that's part of the MAHA movement. Jason Karp, he was the founder of Hugh Kitchen. He actually now is the largest owner of True Food Kitchen, the big healthy food restaurant company, and he's been a big part of this. Callie Means and Casey Means are a big part of this as well, and just so many others. I could mention, Alex Clark, Courtney Swan, Gary Brecka, Paul Saladino, even people like Danica Patrick, Michaela and Jordan Peterson. So many people have been showing up. Dr. Will Cole. Then you've got Aman Hassan, Joel Gator-Warsh, and Stacy Whitman, who is a biological dentist. I mean, there are so many people who are helping lead this movement. Now, I want to touch on the three ways that the MAHA movement is advocating for health freedom. Number one thing that we need across the board, and I think you'd all agree, is transparency. Open disclosure of clinical trial data, pharmaceutical funding sources. For instance, don't you want to know if pharmaceutical funding, where it's coming from, and also if they are being biased towards the research and data? I mean, when you actually think about this, they're hiding their research. when somebody's hiding something, don't you think they're trying to do something that is, deceitful and wrong? I mean, when you look at how many times pharmaceutical companies have been sued and lost billions of dollars in lawsuits because they knew a drug or a treatment was harming somebody, but they covered up the evidence from the studies. So you want greater transparency. I mean, did you know that around 60,000 people, some estimated it was closer to 100,000 people died because a drug Vioxx was causing people to have heart attacks? Think about if that was your family member. And if you knew that a drug company and people, actual people, doctors, scientists, they covered up that information and it was your family member that died because of it. This is one of the things RFK is doing, is he is pulling back the curtains, and he wants you to have, and all of us to have, full health transparency of what's going on. And this includes making vaccine safety data publicly accessible. Can you believe in the first place that vaccine safety data is hidden right now and it's not accessible to the public? Another thing he's trying to do is revealing financial relationships between drug companies and regulatory agencies. First off, it is crazy how common it is that you can have somebody who is the CEO of a drug company or financially invested greatly in that drug company, and then they're sitting on the regulatory committee. So even if it's unsafe, they're just like, pass it because I know this is going to make me more money. Here's another thing: ensuring that health recommendations are based on fully disclosed scientific evidence. This isn't happening today. Number two thing that MAHA is really trying to do is operate with integrity, prioritizing patient welfare over corporate profits. Also end what's viewed as the revolving door between pharma companies and regulatory agencies, and then holding medical institutions accountable for honest reporting on both the benefits and risks of treatment. Again, far too many risks are being covered up. One of the things I've mentioned regularly is that drugs don't just cause side effects from the standpoint of nausea, vomiting, increasing your risk of cancer, those things that sometimes are on the label. Every medication depletes your body of vitamins and minerals. That's not on the label today, okay? So those sort of things should be on the label in the future, but we want to operate with integrity. Number three is this: personal freedom over healthcare choices. Let me ask you this. Did you know that there are children that have been taken away from parents because those parents chose not to vaccinate their kids? There have been kids taken away from parents because the parents wanted to, at first, do more natural cancer protocols. And this is the same true for a number of other conditions. So if it's your health or your child's health, you should be able to make an informed decision. And right now, by the way, here's another issue. A lot of doctors today that want to do things that are more natural or alternative, they're literally not allowed, or they will lose their license. Did you know, as we went through COVID, if a doctor wanted to prescribe ivermectin, they would lose their license because that was not the standard of care. Or if a doctor today, let's say they have a patient come in with breast cancer, okay? And if that doctor, in many instances, if they would say, okay, I don't want to start with chemo and radiation or surgery. I want to start with vitamin C IVs. I want to do, high dose turmeric. I want to radically change that. I want to do Gershon protocol and juicing vegetables. And let's say a doctor wants to do that. Did you know that they are likely to lose their medical license if they don't follow the exact standard of care, which oftentimes is outdated by 50 to 70 years? And the standard of care is really tied to what's best for selling drugs and chemicals via pharmaceutical companies, okay? So people today don't fully have the freedom, and doctors don't even have the freedom themselves, unless they want to lose their license, to recommend certain types of natural holistic treatments. Here's the reality: America is sick today. Over 60% of adults now live with at least one chronic disease. If somebody is 60 to 65 years and older, almost 90% of people that are older are taking a synthetic medication. Here's the other thing: the diseases today that are growing, kids are consuming ultra-processed food, and because of that, kids' levels of diabetes, obesity, and ADHD are at record levels. Autism is at record levels. You know, the amount of people today that are sick with autoimmune disease, clinical depression, it's all at record levels. You know, even mental health is crumbling. 1 in 5 kids has a mental health condition such as anxiety. And the U.S. spends more on healthcare than any other country. So we're the number one spender, by the way, not by a little, by a lot. And we take something like, I don't know the exact stat, but it's around 40% of the entire world's drugs our country takes. And yet we rank around 50th of countries in healthcare. I mean, and that's life expectancy, that's quality of life. We significantly lag because we are not prioritizing the right things. And so what MAHA is doing and Robert F. Kennedy Jr. is doing is it's emerged in a response to medical censorship, pharma overreach, and chronic disease crisis. I'll give you an example, medical censorship. Do you know how many times on the show and on even channels like YouTube, I've tried to talk about vaccines, okay, and have an unbiased opinion, but really as a practitioner who treated patients and took care of a lot of kids in the autistic community, I want to talk about it. I've been censored and not allowed to do it. I did a post on a natural treatment using something called silver, you're all familiar with, and my videos were taken down. So there is medical censorship that's happening online and social media right now, and a big part of it is pharmaceutical overreach. And because people don't know the truth, it's more chronic disease crisis. But because people like you and myself have continued to speak out, this is why MAHA is emerging. It also emerged after the COVID era health policies that raised concerns about all of the suppression of natural health information. I was one of those people who went on podcasts and went on media interviews and early on in COVID, because I was recommending high dose vitamin D, zinc, vitamin C, quercetin, all the things we know now work. I was told I was being unscientific because there was no data on COVID and that working. Well, there was no data either on a lot of the shots working either, or masking or anything else. So all that being said, so many people now distrust the medical system because all of the lies we were told during COVID. That's the reality. That's why MAHA has emerged overall. And so it's really emerged out of a need of, number one really is the health crisis today, though. I mean, you know, more kids, more adults, sicker with chronic diseases than ever before, you know, and people just keep getting worse. And in addition to that, all of the censorship and overreach by the medical companies, that's why. And the core focus of Make America Healthy Again is to rebuild trust via natural foods, holistic medicine, and personal healthcare freedom. And also, here's the thing to know, MAHA is an anti-medicine. I think there is an amazing place for medicine in emergency care. It's pro-truth, it's pro-transparency, and pro-health freedom. That's what MAHA is. And you may not think you're part of the MAHA movement, but here's the thing. If you've ever questioned a prescription, if you've ever worried about what's in your child's school lunch, if you've ever felt like the healthcare system doesn't listen to you, then the reality is you're probably already part of the MAHA movement. And MAHA is a peaceful pushback. It's a call to health to call out the corrupt hands and put it back where it belongs, in the hands of the people. So what I want to do now is go through the main goals of what I know of being able to be on the inside circle with Robert F. Kennedy Jr. and Callie Means, in that circle of what Robert F. Kennedy's biggest initiatives are in helping heal the United States of America and the food system. Number one goal is to clean up the U.S. food supply. That's the number one goal, is to end the chronic disease crisis. Ban additives, ban dyes and chemicals. And by the way, most of these things are already outlawed in Europe. So this isn't even that radical, but it is a priority to ban things that are in food that are not food. Food dyes are not food. Pesticides are not food. Additives are not food. And also, here's another thing he wants to crack down on. Ultra-processed foods marketed to kids. How many kids today consume cereal that is laden with food dyes and highly processed sugar like high fructose corn syrup and refined sugar? Okay, kids today are doing that. They're drinking soda. I mean, you look at school lunches today. This is what's fueling the obesity crisis, the diabetes crisis. You know how many kids now are being diagnosed with issues like cancer early on? It's a major, major issue. And so the number one priority I know this of Robert F. Kennedy Jr., is to help heal our kids, protect our kids, and clean up our food supply. That's the number one goal. Now, as part of this, there are a few other initiatives he has as part of this. One is the promotion of natural healing foods, like less processed foods like raw milk. People have been consuming raw milk since the beginning of human existence, or at least pretty early on, okay? At least 6,000 years. We know people have been consuming raw milk and doing it in a very healthy way. And by the way, you know how many other countries consume raw milk on a regular basis? And they're fine and they're healthier because of it. So this isn't something like we're taking a big risk with drinking raw milk. No, you go to areas of Europe, if you go to, again, different places around the world, raw milk is legal. So the reality is that, it's a healthy food. So again, the number one goal is to clean up our food supply, less processed sugar, less food dyes, less pesticides in our food supply, and help people use food as medicine. That is the number one goal of Robert F. Kennedy Jr., the number one goal of MAHA. And by the way, the reason that's the number one, that leads into number two, is to reverse the chronic illness epidemic. Now, MAHA Commissioner Dr. Robert Lustig, here's what he said. We don't have a healthcare system. We have a disease management system that has to change. Dr. Peter Attia talks about this, medicine 1.0, 2.0. He talks about 2.0 as just managing symptoms with drugs. And 3.0 he talks about as more preventative care, longevity care. Now, there's something even beyond that, and that's using food as medicine, because what he talks about oftentimes is still using a lot of drugs actually to take care of things. So, but overall, Robert F. Kennedy Jr. wants to reverse the chronic illness epidemic. He wants to invest in prevention over reliance on pharmaceutical drugs. Here's my belief system about this, and I think his aligns pretty closely. Alternative medicine should be drugs. First line primary care medicine should be diet, lifestyle, exercise, supplementation, and using herbs. Those sort of things, that should be the first line of defense. If you go into your doctor today and you have high cholesterol or high blood pressure, you shouldn't just be putting a statin drug or a blood pressure medication. That shouldn't be the first thing that happens. The first thing that should happen is saying, well, why does that person have high cholesterol in the first place? Oh, okay. Well, let me look at your diet. You're consuming a lot of sugar, a lot of fast foods, a lot of things that are causing insulin resistance. Okay, let's go now and let's change your diet. Let's get more berries in. Let's do some pomegranates. Let's do some more wild-caught salmon. Let's do a omega-3 supplement. Let's do more vegetables. Let's do more meat. Let's fix the diet first. And then, hey, let's do some herbals that we know have been shown to lower blood pressure and cholesterol. Let's do turmeric. I mentioned fish oil. Let's try hawthorn berry. Let's do that first. Let's start walking regularly. Okay. And then if that doesn't work, then you get on a drug for a short period of time until we figure out what else to do, and then we get you off it as quickly as possible. Because there's a side effect. Statin drugs deplete your body of coenzyme Q10, B12, and a number of nutrients. So overall, again, number two goal of the MAHA movement and RFK is to end chronic illness, stop the reliance on pharmaceuticals, and instead focus on food and lifestyle-based medicine. Okay, part of this is promoting metabolic health, regenerative therapies, and holistic care. Okay, that's number two. Also, he has a great focus on childhood chronic diseases. As I've mentioned today, our kids today are sicker than ever. You look at chronic illnesses with kids. By the way, a lot of this is connected to poor diet from processed foods, environmental toxins, sedentary lifestyle. How many kids today are not spending time outside? I mean, 100 years ago, we had more of an agrarian society where most jobs were related to agriculture and food, okay? And so a lot of kids were with their parents. We're spending a lot of time outside, way too much time inside today. And this is something that even school systems need to fix and start doing better. But he wants to find out also why kids are so sick today. One of the things that I find so inspiring as well is he came out recently and said, I want to find out the root causes of autism, the root causes. What are some of the things connected there? Is it acetaminophen and certain drugs like that are contributing? Is it an unhealthy microbiome and maybe epigenetic things that are turned on with the parents? Could it be antibiotic drugs contributing? Could there be a connection with something like vaccines? Could it be poor diet? I mean, listen, there are numerous things that it could be, but we don't know. But he wants to find out why so many kids have autism today. And I can tell you from my mom growing up, she was a special education teacher. So my mom took care of a lot of kids with autism. And so I spent time around a lot of those kids when I had my practice, functional medicine practice, in person. I saw so many kids with that. Now, of course, I have an online clinic, but when I was in person, I took care of a lot of kids on the autistic spectrum. And I can tell you, I saw phenomenal results in these kids when I changed their diet. Phenomenal results when we healed their gut microbiome, when we did things like hyperbaric oxygen therapy. I mean, when we did these advanced therapies, the improvements were radical. But he wants to also find out what is the root cause of it and how to heal it. And so this is part of the things he's doing. So it's everything from childhood obesity to childhood diabetes to autism to ADHD to also why are adults so sick? So that is the second greatest initiative he has. So you've probably seen the headlines, inflation, tariffs, recession, and the truth is there's a lot to be concerned about. Many economists are warning that a recession could be coming soon, and just like we take steps to protect our physical health, we also need to take steps to protect our financial health, and that's why I'm turning to physical gold and silver to help protect my retirement and saving. Now, I personally trust Preserve Gold. They can make the process simple and they genuinely care. They're amazing Christian people I really respect. Right now, they're offering a free wealth protection guide. And you can get this by just texting AXE, that's AXE, to 50505 to get this free guide. Plus, you can get up to $15,000 in free gold or silver with a qualified purchase. Don't wait, text AXE to 50505 today and take the first steps towards protecting what you've worked so hard to build. I'm praying for and excited about your financial prosperity. Number 3 goal of the MAHA movement is to empower parents and families. There is an ancient proverb that Confucius, I believe, is the one who said this. He said, if you want to feed people for 1 year, plant wheat. If you want to feed people for 10 years, plant trees like walnut and fruit trees. If you want to change the world, educate children. Okay. Empowering parents and kids and families is one of the greatest things we can do in order to heal the planet and heal the world. We want to defend natural birth, homeschooling, and vaccine choice. These are things that we want to empower parents to do, and also teach parents how to feed their kids. You know, a lot of parents, they just don't know. I mean, growing up, let me give you an example of this. Growing up, my mom wanted to feed me healthy. And so she bought a product called Juicy Juice. Now, the formula is a little different now, but at the time, I remember flipping over the bottle and it said, contains 10% fruit juice. What was in there? It was food coloring and refined processed sugar. And I'm talking about like 50 grams per serving. It was like drinking soda. But here's the thing, my point with it, and that's part of the reason why I believe my mom was diagnosed with cancer, is because she was drinking so much of this sugar and processed juice all the time. And that's the reason I had ADHD so bad as a kid. But here's the thing, my mom tried so hard, but she didn't know. She wasn't educated on nutrition. She knew nothing about it. And so our family suffered because of it, and we were sick all the time growing up. Today, the MAHA movement is about educating parents and children. I mean, this is part of the reason why I started in the past drax.com and why I'm constantly speaking is myself becoming educated changed my health and my life. It might have saved my mom's life and the lives of other people. And so I feel so passionate about educating the public, as does RFK Jr., as does other leaders in this MAHA movement like Vani Hari. We want parents to be educated and understand the truth and have the freedom for things like natural birth, homeschooling, and vaccine choice if they want. Number 4 goal of MAHA is reform school lunches and health education, okay? Get the processed junk and seed oils out of schools, okay? For any of you that attended both a public or probably even private school, school lunches are junk. I mean, I remember, pizza on Fridays, chicken nuggets, tacos. Parents, you know what I'm missing there. I mean, it's absolute junk food. Everything is incredibly unhealthy. I remember doing soda or chocolate milk, highly pasteurized chocolate milk, and that's what I ate every day, is absolute junk. And so number 4 goal of the MAHA movement is to overhaul school lunches and teach kids real health, not just the calorie myths or the outdated food pyramid, truly how to use food as medicine, about fruits, about vegetables, about organic meats, about the difference between grass-fed and not grass-fed, organic and non-organic. So teaching kids, and maybe even teaching kids how to garden themselves, how to cook at home. So that's the number 4 goal behind MAHA, and honestly, that is going to make such a big difference. By the way, is there anything I've said so far that is political that you would disagree with, right? Think about this. People keep trying to make this, being healthy and caring for our kids, trying to make that political. It's not political at all. Here's one other thing I want to mention, and you might think this is political of all the things I've went through so far, but RFK supports state efforts to restrict the purchase of unhealthy items like soda and candy with the Supplemental Nutrition Assistance Program with SNAP benefits. He wants to aim to help people that are in low income populations, empower them and support them in buying healthier real foods. And so that's another goal. Maybe that's political. Maybe you think if somebody's low income and maybe they're not educated on their food choices, they should be incentivized or be equally incentivized to buy soda or candy versus organic meat, fruits, and vegetables. But that is something that he wants to be able to do in the future, is influence and educate low income communities, but also incentivize them to spend those SNAP benefits on healthier food choices. Number 5 is this, goal of MAHA: protect medical freedom and rebuild trust in science. Here's the thing. Let me ask you, do you trust the science? I remember Anthony Fauci saying this, well, trust the science, and then him basically alluding to himself as the science, a sort of God complex. Rebuild trust in science. Listen, did you know there was a study that came out on studies a few years back, and it said that around 50% of studies are accurate and 50% are not accurate? Isn't that crazy? And here's what they went through. A lot of studies today, people running the studies are cherry picking the data. Many of the studies are done on very, very small subsets of people. Many of them are biased from the start of a pharmaceutical company funding a study and trying to push it and showing that the drug's safe and not looking at certain things. I mean, so they're all. Let me give you an example of this. Do you know how many studies are done on red meat? There are some studies showing red meat is unhealthy, bad for the heart. There are studies showing it's great for the heart and reversing heart disease. How do you know which one to believe? Well, one, who funded the study? Is it done on grass-fed or non-grass-fed? So overall, and then these companies will basically cover things up in order to get their way. And this happens with the government. It happens with the CDC, happens with the NIH, or has historically today. So think about how much did you trust the government or the medical association coming, or your doctor coming out of COVID? I mean, the amount of people that lost trust is absolutely incredible. I mean, it's incredibly high. And first off, I didn't trust in the first place, but I saw the deceit exposed at an even higher level. So again, one of the goals of MAHA and RFK is to protect medical freedom and choices and rebuild trust in science. Okay. I want to tell you something that happened yesterday. I had a mom who sent me a text message. This is a family friend, and she said, "Hey, Josh, can you sign something for my child? Because in the state of Alabama right now, they are not allowing my child to remain unvaccinated because they no longer allow for religious exemptions." Now, here's the craziest part. She sends her kids to a private Christian school. Okay. And so you go to a private Christian school, and that school doesn't allow you a religious exemption for that. So these are real things happening with people right now. People do not trust the medical system. So we want to rebuild the trust. And ensure the right to informed consent, second opinions, and alternative treatments without discrimination, and also stop the censorship of licensed medical professionals who share information about alternative medicines and viewpoints. I think about Dr. Malone, Dr. McCullough. Dr. Martin Makery, who didn't lose his license, and now he's the head of the FDA, was one of the most outspoken people. I think the only reason why he didn't lose his license, he was questioning things constantly on Twitter, which is now X, is because he was the chief, medical analyst for Fox News, and so he was somewhat protected there. But a lot of doctors lost their license when they were speaking truth, and a lot of people too, they don't encourage open debate and evidence-based discussions at all. Number 6 goal of RFK is restructuring of health agencies and end the death grip that big pharmaceutical companies have on these agencies. No more revolving doors between the FDA, the CDC, and the drug companies. Again, it is mind-blowing, and you've probably maybe seen these posts even on social media, how often you have, somebody who worked at Pfizer or Merck or GlaxoSmithKline, one of these pharmaceutical companies, and the next year they're running the FDA or the CDC. I mean, it's absolutely morally and ethically wrong. Having full disclosure of financial conflicts of interest, including pharma companies who donate lots of money to policymakers' campaigns, that happens a lot. So us having full disclosure and understanding of that. Marty Makery did a great interview where he says he is going to fix this issue. He's going to fix the issue where you have people from pharmaceutical companies that are sitting on these boards oftentimes as well, where there is a major conflict of interest. I mean, just take a minute, watch this really, really short clip.
We are removing industry members, pharma members from FDA advisory committees. I was shocked when I learned that employees of big pharma companies sit on FDA advisory committees as members of those committees. So we're going to be replacing them whenever statutorily possible with patients and family caregivers. We are going to be inviting pharma companies to send representatives to the advisory committees, but they can sit with the rest of the public and watch and pose questions as the rest of the American public.
And then number 7 is advance regenerative agriculture. Listen, we want to support sustainable farming practices that rebuild our soil, reduce chemical reliance, and promote biodiversity. Did you know that a lot of our food today has sometimes 70% less nutrients than it did 100 years ago? And when you look at an apple and tomato, it has far less magnesium, iron, and other nutrients than it did, again, 100 years ago. Way less, because when you plant the same crop year after year and do what's called monocropping. Mono means one, right? Of soy, corn, wheat, over and over and over again. You don't add the nutrients back. You deplete the soil. So when you don't have topsoil, that's that thick black or dark brown soil. Instead, it's that kind of light brown, like hard dirt. That's not topsoil. You want topsoil. Things grow better in that. And they're more nutrient dense. Okay, so part of the problem today why most people need to take a multivitamin or take supplements is you're not getting the same nutrition you did from your food, the same nutrients, vitamins, and minerals and antioxidants than you did when you ate a food 50 to 100 years ago. And so he wants to create initiatives and support farmers in doing more regenerative agricultural practices. I mean, this is something myself and Jordan Rubin practice right now. We have 4,000 acres we own in Missouri, 150 in Tennessee, where we practice regenerative agriculture. And we've been building back topsoil very quickly with the way that we have been doing our farming. And this is the biblical method of farming. They actually do this method in New Zealand as well. But regenerative agriculture is the future. And if you want to eat the most nutrient-dense healing food possible, that food will have been created via a regenerative agricultural process. Number 8 initiative of Make America Healthy Again is address environmental toxins. There are so many hormone-disrupting chemicals in plastics, cosmetics, in our water supply, in our food supply. He wants to ban glyphosate and PFAS, these forever chemicals that are so damaging to our overall health. You know, studies have shown that glyphosate, it changes and alters our gut microbiome and increases our risk of cancer and numerous other health problems. And so he wants to get that out of our food. Number 9, goal of MAHA, vaccine transparency and choice. No more mandates without long-term safety studies. Also, a push for full audit of the childhood vaccine schedule. I mean, when I was a kid, I think I got a total of 4. Literally, a total of 4 shots total. Today, the requirements or recommendations are like 70-some. 72, 70. By the way, I can't keep track of the number because it went from 66 to 72 to higher 70s. I saw somebody post recently that between the age of 0 and somewhere in your early 20s, it's like 90 different shots at least. I mean, it's incredibly high. So the number just continues to decline. He wants to do a full audit on the childhood vaccine schedule. I mean, by the way, do you think we should be looking at what the healthiest country in the world recommends and does? Do you think in Japan they get as many shots there as we do here in the United States? No, it's far less, okay? And it's done at an older age and not as young either. It's spaced out more. So overall, even those recommendations, I'm not even saying those are right, but I'm saying it's very different. You know, there was a recent headline where Robert F. Kennedy Jr. Decided to remove all 17 members of the CDC's Vaccine Advisory Committee. I mean, he's doing a complete overhaul, and I applaud him on this because the reality is, listen, let me ask you a question. Do you trust pharmaceutical companies? Okay, the next question is, who has a vested interest in people getting more vaccines? Pharmaceutical companies, okay? That financially, they have the greatest incentives. So do you think maybe, just maybe, there's a slight chance that if you injected something into your body that was full of chemicals and things that are artificial and creating an artificial immune response, do you think that maybe potentially there could potentially be any type of side effects at all, at least with some groups of people? You know, a few years ago, I went through one of the toughest seasons of my life with an injury. And one of the things I realized at that time was I needed to get better sleep in order to heal. And during that time, rest, healing, recovery, and overall deep sleep was so important. And one of the things that happens sometimes and keeps me from getting that deep, restful sleep is I get too hot at night or too cold. And because of that, comfort became incredibly important to me. And that's why I love Cozy Earth. Their bamboo viscose sheets are the most breathable, temperature-regulating sheets I've ever used. Even during the hottest summer nights, I sleep cooler and wake up feeling refreshed. Also, their studio pants and all-day tees are incredibly soft, perfect for rest, recovery, and just everyday life. Try them during the hottest nights of the year. If you're not in love, return them hassle-free. Plus, they come with a 10-year warranty on all bedding products. That's a decade of cool quality sleep. Trust me, you'll feel the difference the very first night. Go to CozyEarth.com and use the code AXE, that's AXE, for 40% off. Sleep cooler, lounge lighter, stay cozy. And here's the reality is most people don't even want to don't even want to talk about it. They don't even want to talk about it. And listen, I think part of the reason is if a parent went and chose to do it and it turned out to maybe not be as good as they thought, they might feel like they're a bad parent. And so because of that, people are fighting tooth and nail in fighting each other, the people that are against it and the people that are for it. But overall, I'll just say this, we need more transparency. We need to make sure these studies aren't biased. By the way, there is so much false information when you go back and look at the history in terms of a lot of these diseases were already going out of existence way before that shot was introduced, way before. So if somebody actually decides to watch documentaries and read books and truly understand, and by the way, I'd encourage you to listen to both sides and then make an informed decision. I think that's it. Vaccine transparency and informed decisions on both sides, open discussions. But the problem is today, by the way, if somebody doesn't even allow the questioning of things and they're trying to cover things up, doesn't that make you question them a little bit? So again, the number 9 goal of MAHA, and this is probably the most, I guess, polarizing of people, is just asking, just asking for transparency and for freedom of choice. Number 10, legalization of natural and alternative therapies. Kennedy had a great post on X several months back where he said he wants to legalize a lot of these alternative therapies that are legal in other countries. I mean, today, if you want to get the most advanced type of stem cell therapy, you have to fly to Mexico or Panama or Colombia or Switzerland or Germany. You have to leave the country. Like for myself, in healing my spine, I have had to fly to Mexico to get my treatments. Now, listen, I like going on a trip to Cancun. It's not bad. It's not far from Nashville, Tennessee. But would I prefer to be able to just drive to, 20 minutes to see a regenerative medicine practitioner and get that same treatment here in the United States? Of course I would. And Kennedy is advocating for expanding access to alternative treatments such as stem cell therapy, peptides, CBD, and so much more. And his administration supports the use of using your health savings account, your HSA, for non-traditional remedies like vitamins and supplements and gym memberships and food and supplements in these natural alternative treatments. There's actually an initiative that was founded by Callie Means, who is one of RFK's aides, called TrueMed, where they're trying to do just that. So here's RFK's tweet, and this is one of my favorite tweets he's ever done. So here's what he said. The FDA's war on public health is about to end. This includes its aggressive suppression of psychedelics, peptides, stem cells, raw milk, hyperbaric therapies, chelating compounds, ivermectin, hydroxychloroquine, vitamins, clean foods, sunshine, exercise, nutraceuticals, and anything else that advances human health and can't be patented by pharma. If you work for the FDA and are part of this corrupt system, I have 2 messages for you. Number 1, preserve your records, and number 2, pack your bags. This is at the heart of the MAHA movement, what it's all about. Getting you access to some of the most healing and transformative foods that you don't have access to right now. Because people don't have access to some of these things right now, we have more autoimmune disease, we have more obesity, we have more people suffering with chronic issues because they don't have access to the world's most cutting-edge health therapies. Right now, when you look at the United States in a snapshot, the life expectancy, this was pre-COVID, was 78.8 years, where there are many other countries like Japan that are living much, much longer, and 4 out of 10 Americans have 2 or more diseases, not one, have 2 or more chronic diseases right now. A few other things here that are kind of shocking when you look at how sick we are today. Did you know that 77% of young adults are disqualified to serve in the military due to their health scores? You know how many people today have anxiety, have depression, have IBS, have autoimmune disease, are obese? And so they cannot serve in the military. 77%. Chronic and mental health costs, 90% of the U.S. healthcare budget, which is $4.5 trillion, goes to treating mental health issues like depression and anxiety. The U.S. had the highest cancer rate worldwide. It nearly double the rate of the next highest country. Think about that. The United States has the highest cancer rate in the entire world of all countries, yet we spend the most and we have the most drugs. Things have to change. Cancer has increased from 1990 to 2021, an 88% rise in cancer, the highest of any country. Asthma, more than twice as common in the U.S. than Europe, Asia, or Africa, partly due to all of our chemicals that are in our environment. Autism and autoimmune disease. We have the highest prevalence in high-income countries, the United States being the highest. Okay, the highest of all countries. Children with at least one health problem were the highest country. Autism, as I mentioned, 1 in 36 children today, which is up from 1 in 10,000 to 40,000. Now, I do want to mention with autism, we need to create 2 categories. High functioning, which Asperger's, and low functioning in terms of it really impacting children to be able to be in, public or private, school today. Okay, so we really need to create a separation there. But either way, still, autism has climbed, and it's climbed the most in the United States of America. Here's a few more. Fatty liver disease is up 18%. Pre-diabetes in adolescents is up 30%. Adolescents being overweight or obese is up 40%. Children with ADHD or on ADHD medication, 3.4 million kids are taking this. And so again, there's a lot of issues there. And here's the great news. MAHA is already making a difference. I mean, recently we saw these school dyes banned. I didn't think it would ever happen. Of course, it's banned in these other countries, but because you spoke out and so many people spoke out, these food dyes have been banned. I want to say it was like 6 to 8 petroleum-based food dyes have been, they've been banned, and there are already companies removing them. Right now, I've started seeing recently people stop using a lot of the seed oils in a few fast food restaurants, saying we're going to move to beef tallow or duck fat or avocado oil or extra virgin olive oil. So we're going to change the fats we're using. So we already see people making changes, organizations making changes, and so things are moving in the right direction. Here's the reality. MAHA is a movement that believes that Americans shouldn't be passive patients, but informed participants. So the number one goal of MAHA, change the medical system, change our food system, educate people, and give you freedom of choice and access to things that you want, like raw milk or peptides or whatever it is. And considering how much chronic illness, toxin exposure, and one-size-fits-all medicine Americans face, MAHA offers a different vision, one based on sovereignty, science, and common sense. And if you've ever felt dismissed by a doctor, silenced online, or overwhelmed by conflicting advice, MAHA was built for you. It's here to help transform the entire healthcare system for my good, for your good, for all of our good, for the health of this entire country. And again, I want to applaud Robert F. Kennedy Jr., Marty Makery, Dr. J, who's the head of the NIH, Mehmet Oz, who's the head of Medicare and Medicaid. These people are changing the world. And again, I've been very blessed to have sort of inside access of being able to talk and know what these priorities and initiatives are. And if you want to know what they are, well, there they are. All right, I want to say thanks so much for tuning in here to the Dr. Josh Axe Show. Remember, every week we're diving deep into the science and principles of how you can heal physically, mentally, and spiritually. By the way, I want to say thank you to all your all you subscribers. The number one thing you can do to support this show is subscribe, to like, and also share. So many people are misinformed about what MAHA is and what RFK is up to. Would you do me a favor? Would you share this episode? Because so many people don't know the truth about RFK and about MAHA, and people need to know. I want to say thanks so much for listening. Thanks for sharing. I'll see you on the next episode.